So the goal of prenatal tests is to make sure that we get a healthy baby once the baby delivers. So we want to do some testing to make sure there is no issues with the pregnancy or the baby. So some of the testing involves testing to make sure the mom is healthy. For example, checking blood pressure, checking blood glucose to rule out any gestational diabetes or hypertension. And some of the testing is geared towards the baby to make sure the baby is healthy. And these include ultrasound to make sure all the structures are normal. There is no, for example, cleft lip, cleft palate, the stomach, the heart, everything looks okay. And then doing some blood tests, one of which is called NIPT, which is a blood test that the lady will do around 11 weeks of pregnancy to make sure that the baby doesn't have Down syndrome or other common genetic problems. With that blood test, we can also tell the gender of the baby if the patient is interested to know. And then as the pregnancy advances, there are other tests that can be done besides ultrasound and blood tests. One of them includes chorionic villi sampling, where the doctor will take a piece of the placenta and sends that for genetic testing to rule out any chromosomal defects. And then after that, around 15 to 20 weeks, the test called amniocentesis is used, where a little bit of the amniotic fluid is withdrawn with a needle and sent for genetic testing to rule out any problems. There are obviously other testing which are a little bit beyond the scope of this video, but if you've had any experience with problems with genetic problems, or if you're pregnant and you just want to make sure you're healthy and the baby is healthy, we recommend that you contact the doctor to make sure you do all the necessary prenatal care to make sure your pregnancy turns out to be healthy and successful.